It is common knowledge that brain dominance affects various activities such as writing or throwing a baseball. However, the extent of brain dominance on different physical activities is not fully understood. Studies have shown that rising up from a chair may not be a symmetric event as previously believed to be. This experiment evaluates the vertical ground reaction forces of 11 participants over time throughout the standing up process. Attributing asymmetry to brain dominance was deemed out of scope for this experiment due to the limited population of left-handed participants. The findings of this experimental procedure can provide knowledge to help improve the rehabilitation process for patients with unilateral physical impairments. Exercises and various therapy techniques can be designed to fit the particular needs of the patients to speed up the recovery process. The specific task of rising up to stand from a chair was chosen since it is considered to be one of the most physically challenging tasks performed in everyday life. We believe that most asymmetry will be observed at the beginning of the movement. Furthermore, we anticipate that the ground reaction forces will even out and become more symmetric as participants come to a full standing position. Again, while the correlation between brain dominance and the act of rising to a stand from the chair is the motivating factor in this experiment, due to population limitations, only the statistical presence of asymmetry will be analyzed. Further studies could expand upon this notion.
A Wii balance board was first connected to the computer and then marked with tape to denote where the participant should place their feet. The Wii balance board was placed on the ground in front of a stable chair in which the participant was asked to sit. The participant was given instructions to rise from their seated position as they normally would, but with a minimal use of their arms. Vertical ground reaction forces were collected and recorded for both the right and left side of the participant over time. The ground reaction forces were used to calculate the symmetry indices over time for each participant using equation 1. An index of 0.5 indicates symmetry, other values indicate asymmetry. This figure displays the averaged symmetry indices of all the participants over the entire process of rising to stand from a chair, along with the standard deviations. It is clear that the most asymmetric movement occurred at the beginning of the standing process. Additionally, this asymmetry continued throughout the rest of the process. The figure displays the average symmetry index for each participant with standard deviations. Subjects with higher asymmetry displayed the highest variability, indicating a more uneven distribution of the vertical ground reaction forces during the rising process.
Running t-tests on each of the participants' ground reaction force data revealed that most of the data was statistically significant. However, the vertical ground reaction forces may not be the best way to test for asymmetry alone. For future studies, additional data such as the asymmetry of the arms or hips would need to be collected to confirm whether this is in fact the case. Some of the factors that might explain the variability are differences in participants' body weight, age, and gender, which were not taken into account in this experiment. Also, limitations in population size prevented analysis of the correlation of left or right brain dominance to asymmetry. While we did conclude that the majority of subjects had statistically significant asymmetry, we were unable to determine whether this was due to brain dominance or some other factor. Future studies can evaluate the other contributing factors mentioned to obtain more indicative results and give more insight into the true effects of brain dominance over various everyday activities.